Dear friends, welcome to EPG Pathshala. And the subject which we are going to discuss is under the broad subject of social medicine and community health. The module which I am going to take you through is the National Blood Safety Program, and this is under the large umbrellaship of national health programs and policies. Principal investigator in this development team is, of course, Professor Vidya-mitra from the Department of Community Medicine, IMS BHU, and he is followed with his full team of learned professors from all over the country. When we want to learn about blood transfusion, this is an important topic since this is actually a lifeline to health which is emergency health. And we should know about blood transfusion, its problems, and the fact that when and where to use, how to use, and how to take it right down to the grassroots level. Our country is a wide land, and previously, about 70% of the population stayed in the rural areas, whereas now there is a lesser amount in the rural areas, but still transfusion is needed everywhere wherever an emergency occurs. Therefore, it is important to know about blood transfusion, how it is to be transferred and how it is to be given, what are the factors which we should consider in its full safety in the procedure and safety to the patient, so that at the end of the day, we get a comfortable, a safe and a healthy patient. Blood transfusion is an essential component of healthcare. In fact, it has now become a procedure which is actually a lifeline, and it often saves millions of lives every year all over the country, whether it is rural, urban. The need for it is also important that blood transfusion, although the centers are mostly in the urban areas, it is important that we should create such a system wherein the blood can be transferred, could be taken safely to the person living in the rural areas and who is in need of an emergency transfusion. Thus, the need for equitable and timely access to safe blood is universal. Now, every country needs to meet its requirements for blood and blood products and ensure that blood supplies are free from HIV, hepatitis viruses, and other life-threatening infections that can be transferred through unsafe transfusion. Now we see a very nice picture of a blood transportation plan. Blood transportation has to be done in such a manner that it can be taken in its proper, safe condition right down to the patient who is waiting for the blood at the grassroots level. These vans are now a regular part of our life picture, and we see that blood is transferred in a very comfortable manner right down from the blood bank to the distant places where it is needed. In fact, these vans also have another purpose. These vans may also act as actually blood donation centers, because now what is happening is that what we are trying to promote in our country is voluntary blood donation without remuneration. In the previous times, we knew that patients, in fact people, used to stand in large lines in front of the blood banks in order to give blood, but at a cost. That is a system where we were not sure about where the actual person was coming from, what was his background, what were his habits, whether he used to smoke, whether he was a drug taker, whether he was an ill person, and yet he sold his blood because it was important both for him and eventually for the patient. Transportation vans have now become an everyday visual scene in our lives. The van runs from place to place carrying that urgent lifeline and life-supporting nutrient. Blood is actually a nutrient which has to give life to that ill person and who needs a blood transfusion. In fact, as I was saying earlier, that these blood transportation vans not only act as transportation vans, but blood donation may also be given inside these vans where needed. So it has a double role. One, we collect the blood in all its comfort and its security, and two, the blood which is already there, which the van has been carrying, can be safely transported to the grassroots level. The objectives under the National AIDS program in the part 3, we have to ensure a regular voluntary non-remunerated blood donors which constitute the main source of blood supply. As I said earlier, that we used to have people who used to sell blood because both for themselves and for their drug supplies. So therefore, we have to try and wean ourselves away from this payment for blood to a regular voluntary non-remunerated blood donor, which will be definitely on a safer basis. We have to establish blood storage centers in the primary health center care system for availability of blood in far-flung remote areas. Like I said, our country is partly village-based, partly rural-based. We need blood and we need a proper blood lifeline to these centers. We know that in the health system, we have established lots of small centers like sub-centers, primary health centers, now the first referral units, and these are the places where the blood should go so that these are within the reach of the patient who requires the blood on an urgent basis from the grassroots level. Unfortunately, we have to stop the blood storage at the first referral unit since these are equipped properly with the refrigeration and the proper methods to store blood and to give blood transfusion. Therefore, the primary health centers, if the patients are coming, they have to come to the first referral units in order for the first aid and first transfusion. While establishing such centers, it is important that the blood transfusion, the blood which has to be carried right from the main centers down the line to the rural areas full care must be taken to keep that blood absolutely safe and safe. The next thing is that we have, without promoting awareness for appropriate use of blood components and blood products, both amongst the clinicians and the patients. One of the most important things which we learn in preventive and social medicine, in community medicine of today, is health education is an important part and parcel of the lives of us doctors. This is important because without promoting health awareness for use of not only blood transfusions which we are talking about, but it is for acceptance of the complete comprehensive health coverage for the individual and his family. So we need to promote awareness for appropriate use of blood and its different components amongst the clinicians, both amongst the clinicians as well as the patients coming to them. The clinician must diagnose, examine and find out exactly which part of the blood or the blood component is required. It could be the platelets for the thalassemia patients, it could be a full blood for a bleeding mother or a very sick person, or it could be merely serum which is needed, or it could be white blood cells. Another important part which comes to mind is that it's not only promoting awareness, but it is also creating a capacity amongst the workers who are actually giving the transfusions in different places. They must be fully trained, they must be aware of the dangers of blood transfusion, and they must know the full method in which how the blood has been collected. Because without being properly trained and without knowing how the blood transfusion has taken place, he cannot do full justice to his job when he starts the blood drip into a sick patient. Next, he must also take care that the patient is in a very comfortable position. He has no mental tension. He is lying down comfortably and he is given full comfort, and so that the blood transfusion takes place in a very congenial atmosphere. The patient is happy and the staff is happy because the person is going to recover fast from his emergency status. Therefore, organized training programs for various categories of staff must take place at trained clinicians and trained technicians who will teach this myriad people in order to give blood transfusion safely. During the course of National AIDS program number 3, the status of various activities under the blood safety is as follows. You see, number 1 I would like to mention is that the total blood collection has definitely increased from 4.4 million in 2007 to 7.9 million units in 2011. Why has this taken place? This has taken place because of increased awareness, because of increased training. The most important is creating an awareness amongst the population is that it brings them closer to actual blood donation. Therefore, 14th June of every year is taken as a blood donation day, wherein all our voluntary organizations collect together and give blood donations, both voluntarily, without payment, and in a very happy state of mind, so that the many hundreds and thousands who require blood will be not at a loss. Voluntary blood donation has definitely increased from 52% to 79.5%. And the main reason for this is because of the awareness which our government is giving, which our doctors are giving, and which the people themselves are realizing from cases which have been seen in their families when they run from pillar to post for a bottle of blood. Most important is, since we are fighting against AIDS, and NACO has come in to help in this particular program, supported by the other programs. So HIV zero reactivity is now starting to decline, and it has gone down to 0.2%, which is a very happy state of affairs, because it is mandatory that every unit of blood which is collected must be checked for a number of diseases which can be passed through blood. For example, HIV, syphilis, malaria, hepatitis C. Hepatitis C has also been included from 1st of June 2011, because hepatitis C is a very cunning virus, because it comes into the blood, it comes through the blood, goes into the patient, travels all over, settles in the liver, and stays quiet for a long time, eventually breaking out in the form of either cancer or other infections. So therefore, one must be certain that none of these diseases are being transferred unnecessarily through a blood which is actually supposed to be life-giving. HIV zero reactivity has definitely declined, as I said, and today it's not only the full blood, but 73 blood component separation facilities have been created, and Existing ones have been upgraded, and I would like to mention here, we see that because of safety, taking safety precautions in blood transfusions, the most important is the HIV seroreactivity, which has declined from 1.2% to 0.2%. Now, blood component separation facilities have been created and have been upgraded to and have been added to the already existing ones to ensure appropriate clinical use of blood. This is very important because merely wasting blood, full blood, is not the right thing. There are several uses for the plasma, for the red blood cells, for the white blood cells, for the platelets. And here I would like to mention that every unit roughly contains 55% of one unit is actually plasma, whereas 45% is erythrocytes or the red blood cells. In between them is a buffy layer which consists of platelets and white blood cells, which is even less than 1%. Therefore, component separation is good because these components can be used separately where needed as life-saving. Here I would also like to mention that our 4 metro cities have been upgraded to the state-of-art unit with blood transfusion centers, and they have 100% voluntary donations, which are non-remunerable voluntary donations, and 100% units of the blood which are coming have been fractionized to its proper uses. 18 district level blood banks and 685 blood storage centers have been established. These are still less because we need blood centers which should cover every single area of our country. Blood mobile and blood transport vans were provided to augment voluntary blood collection and transportation of blood from blood bank to blood storage centers. This is important because, as we have already seen in a photograph which went earlier, that blood transportation vans now are being used in every possible state, in every possible district. These are actually lifeline transport vans because they not only, as I said earlier, they not only transport blood, but they also act as blood donation centers. Capacity building through in-service training is, of course, a very essential component because without the staff being trained both mentally as well as physically, it is difficult to bring their attention to the importance of blood transfusion and their services which are required in order to see that this transfusion service runs in a smooth process. National Blood Transfusion Policy. This has actually become a national program just like the other programs, and it is of importance because it is directly related to life-saving measures. Wherever accidents occur, wherever deliveries are taking place, wherever children need the blood or the blood plasma, the government has committed itself to provide safe and adequate quantity of blood components and blood products at the right time to the right place in the shortest possible time. To make available adequate resources to develop and reorganize the blood transfusion services in the country, many steps have been taken. The most important step is the National Rural Health Mission. The National Rural Health Mission was inaugurated in 2005 April by our then Honorable Prime Minister Manmohan Singh. This national health policy was to see the places to make the latest technology available for operating the blood transfusion services and to ensure its functioning in an updated manner all the blood banks are now being updated. Regular training is taking place to ensure effective functioning of both the workers as well as the center. And to launch extensive awareness programs, this is now the outlook of the government as well as all the comprehensive programs. And this has to take into consideration the donor information, education, motivation, recruitment, and retention in order to ensure adequate availability of safe blood. Now, for this, awareness programs have to be launched right down to the public so that it is the public from where we are going to get our voluntary donors who are going to come and give us that life-saving blood. The National Rural Health Mission was launched in 2005 by our Honorable Prime Minister Manmohan Singh ji, and this was to emphasize the underserved areas of our rural areas, and it was to create an awareness to bring comprehensive health care right down to the grassroots level, to the last house in that village. Since this program covered education, nutrition, and a lot of other factors, for example, environmental sanitation, nutrition, therefore, in order to make it a better program, they also launched the National Urban Mission, and this was to extend into the cities and into the it was to combine both the urban as well as the rural comprehensive areas for comprehensive healthcare programs. The best part of it was that in this launch, states like Jammu Kashmir, Himachal Pradesh was also included, and thus the whole country was to be covered with a comprehensive healthcare program, and this was to actually act as a base for extending these blood transfusion services in a better and in a more compatible manner down to the last village. The National Blood Transfusion Policy has always acted in the best interests of the public. We have to encourage appropriate clinical use of blood and the blood products. We have to emphasize again and again that this is where the clinician comes in, and his use of his knowledge and proper use of which product has to be used when. Then we have to strengthen the manpower through human resource development, but this can be done through voluntary recruitment and then to train these people. In fact, ordinary person can also be trained to bring in and help a person who needs a transfusion or who needs clinical help. Then to encourage the research and development in the field of transfusion medicine and related technologies, our medical colleges, our state health units are all coming in so that they can put together this knowledge and serve it to the rural areas, serve it to the outreach areas where this expertise can be used to better the services in those areas. And of course, the government is taking regulatory and legislative steps for monitoring and evaluation of blood transfusion services and to take steps to eliminate profiteering in blood banks. Now, I would like to speak a word on this because this is very important. Legislative steps are important if we want to consider the fact that we want to create a safe and a voluntary blood donation, wherein that blood which goes to the patient is completely compatible with what has to be given. Voluntary blood donation today has actually become the cornerstone of a safe and adequate supply of blood and blood products. This is where we are saying again and again, those old ancient methods of blood donation from people, from sick people, from those people who wanted to sell their blood. And in fact, many of them, we hear stories and we read stories that many people who were sick would sell their blood just to get a supply of drugs. This is not safe. So that safety margin we have to bring today as the most important stone and the base of our blood donation as well as the blood transfusion services. The objectives of collecting blood through voluntary blood donation are very important. Because one is when a voluntary person comes in by himself, he is coming with a clear and a safe mind. He is coming with a clear mind. He wants to donate and he doesn't want money for it. Therefore, he would subject himself to see that he is examined and his blood is examined for those infections which could easily pass through the blood into another unsuspecting acceptor. So therefore, we provide safe and quality blood and blood components which are collected from these voluntary donors round the clock at affordable cost to the general public, free of cost to the poor. One thing we have to remember, when collecting blood, it is absolutely important to see that the mind and the awareness with which that person has come in to donate his blood is completely satisfactory. He should be satisfied, his questions should be answered, and when he lies down to donate the blood, he should be in a happy state of mind. One thing we have seen is that with the progress of today's thoughts and progress of the nation, wherever these blood camps have been held, they have become very important centers for people to mix together, to talk, to interchange, and to know that they are doing something useful for their country and for their fellow men. These centers have been equipped with very comfortable couches. The blood is taken very comfortably. They are given something to drink, and in general, that atmosphere is a completely comfortable and a very, very pleasant atmosphere wherein the blood is collected. We have to assist the various organizations, clubs, colleges, public and private institutions, and the public to conduct voluntary blood donation drives. And these are being done, and we get reports through the papers, we see the pictures, and India should feel happy that its public is now on the road to understanding what blood donation is. Most important, I would like to mention here is that it's not only that we conduct awareness programs for the rural areas or for the public, but most important is we go to schools, we go to colleges, wherein we can catch the young minds and put them in the right direction to thinking what is right for their country. We are seeing pictures of two happy young ladies who are very happy to donate blood. And I'm glad that there are many women's organizations have also started stepping forward to do their part in this very vital program of our country. And on the right side, we see a very beautiful picture of what I was describing right now. Blood donation is going on, blood transfusion, but it is a very comfortable atmosphere. And this is precisely what we want if we want India to progress in its good achievements for a good, healthy public and a nation. I would like to roughly take you through the organizational structure of a national blood service. And the leader of this entire team is the head or the secretary of the department, followed by the director. He, in turn, is followed by the deputy directors of the blood bank, of quality practices, of administration and finance, which are all essential. And these three in turn, are assisted by their assistant directors, which form a band which covers the entire network, that is the blood bank network, monitoring, the vigilance, the assurance, the quality, and most important, academics, and last of all, the strategy in order to increase and to better the services in our nation. At the end, I hope we have been able to do justice to this topic, in fact, to this very vital topic. And I thank you all for visiting the EPG Pathshala. Thank you and have a good day.